There we go. I'm just going to watch the count go up a little bit. Welcome, everybody. As everyone's coming on, I'll get started. We came on a few minutes early so we could get I think 1 minute early so we could get everybody on and get started to go. So I'm going to start off. Good afternoon and welcome to your Benco webinar, Gateway 2021, Crossing the Bridge into Dentistry. My name is Kay Huff and I will be your Benco host for this afternoon. On today's webinar, we are going to be celebrating National Women's History Month. And before we get started, I need to go over a few CE guidelines. Number one, each person that was wanting to receive CEs needs to make sure they registered in their legal name. And what I mean by that is the name that's on your license. And also each person registered must log on their own device. The way we give out CEs is that we know you're on, so we can tell when you sign on and when you sign off. So please make sure you stay on for the entire time. Also, if you're calling in from your cell phone, now this is only if you're calling in from your cell phone, all we see is your cell phone number. So what I will need you to do is email me your name, your telephone number so we can cross-reference it, and to the title of tonight's course. I want you to email that information to practicecoaching@benco.com. Again, that's practicecoaching@benco.com. Don't panic. We'll also give it to you at the end of the program. So don't worry about it. We'll remind you one more time. Also, you will be receiving a survey at the end of the webinar. Please make sure you take your time to fill that survey out. We really want to know what you want to see in the future because we really want your opinion. So please make sure you send that in. Also, at the very, very bottom, you're going to see a Q&A. We would love for you to ask our panelists questions. So please make sure you click on the Q&A button and type in all of your questions there, and then we will go over those live on today's webinar. So with that being said, let's get started. I am honored, very honored, who I just can't wait to introduce one of our managing directors at Benco Dental, Chuck Cohen. Hey, Chuck.
Hi, Kay. Well, this is Chuck. Thank you very much. The one who's honored is me because I'm the only non-female on the program this evening. So I am the one who's honored to be invited to be here. It is it's the tail end of National Women's History Month. And we are honored to have 4 fabulous women here today to speak with us about what it's like to be a woman leader in dentistry and what, where dentistry is going and the perspective from female practitioners. So I am blessed to say that I knew before this evening 2 of the 3 panelists this evening. So of course we have Kay, you met her already. Dr. Marsha Gordon is a pediatric dentist in Allentown, Pennsylvania, happens to be my kid's pediatric dentist. So we go back a long way. She's a fabulous practitioner. And I remember her over the years telling many stories about what it was like to be one of only 1 or 2 women in her dental school class. So she's here. Dr. Laila Hishaw, also a pediatric dentist and in Arizona, is here as well. Very involved in especially people of color in dentistry. So not only does she have her own practice, but very involved in making sure that people of color can be represented in dentistry going forward. So thank you very much for that as well, Dr. Hishaw. And then Dr. Bell is newly graduated, as she just said, one of the members of the COVID class of 2020 and presently in residency for general practice in Atlanta, Georgia. So we have 3 generations, 3 fabulous women, all talking about women in dentistry. Thank you very much for being here this evening, ladies. And thank you very much for sharing your stories. And thank you to everyone who's here to watch and participate this evening. So with that, I'll turn things over to Lindsay Pross, who's the manager of Benco's event and travel team and very much involved in our Lucy Hobbs project. So Lindsay?
Thanks, Chuck. So the Lucy Hobbs project is Benco Dental's initiative that celebrates and supports women in dentistry. But first, a little bit about who Dr. Lucy Hobbs Taylor was. She was the first woman in the United States to receive a license to practice dentistry. And she was denied entry into dental programs multiple times because she was a woman. But Lucy didn't give up. She persevered and eventually was finally accepted into the Ohio College of Dental Surgery. a short 3 years after she graduated, she opened her own practice. And this is my favorite part. She taught her husband dentistry. So it's a beautiful legacy. The initiative that we have is based on 3 pillars: innovation, give back, and networking. All of Benco Dental's Lucy Hubs project endeavors are built on and celebrate these pillars as they were the core values of Dr. Hobbs. So what do? We have a series of events throughout the year across the country. So we have our Lucy Hobbs Project U events, which we work with dental colleges across the country and put together a program for their alumni and current dental students to come together, really trying to foster the environment of mentorship. A huge part of Lucy Hobbs's story is that she had mentorships throughout the time that she was trying to be accepted into different schools. She always had a mentor that really guided her, and she was not afraid to, you know, bounce ideas off that person. And we've learned in many conversations, panel discussions, that this is so important, especially for alumni and for current students. So it's really beneficial. We always have, for all of our events, a give back component. And so the Lucy Hobbs Project has donated thousands of dollars over the years to different causes. When we do our university events, we allow the university to choose a cause that is local and is really near and dear to the hearts of those who would be attending the event. So that's been incredible. Also, the Benco Family Foundation does match all of the dollars that are raised, which is nice. We also do a series of events that are called our regional events. And so basically what that is when we have women who have signed up for the Lucy Hobbs Project, and you can do that on our website, lucyhobbs.com. You just sign up, you're a part of the community, you will get emails, updates, there's a blog, and you'll see what's going on in different areas of the country to join in. So we've had women who have joined that community and have said, you know what, I really want to have a Lucy Hobbs Project event. And so we have partnered with them to help with planning, building content, sourcing different speakers, and certainly we split some costs with the group so that they can have an event that is outstanding. And we've done very many throughout the country in different states. What else? The big thing, and the nominations are open right now. So please, one of our biggest things that we do is we have, it's not a contest. It is a way for us to shine light on 6 outstanding women in the dental community. We have 6 different categories that someone might be nominated for, and they are the clinical expert, innovator, the industry icon, the woman to watch, humanitarian, and mentor. And so we get nominations, we seek nominations throughout the year. The nominations will close on July 1st. So please do go to our website, lucyhobbsproject.com, to place a nomination if you know a woman in your world that is in dentistry who is outstanding and should have recognition. So what is the recognition? Benco Dental has Incisal Edge magazine, which is a beautiful publication that is sent to 136,000 dentists across the country. And we do a feature of those 6 women who are, you know, we get all of these nominations, and there's a diverse judging panel who goes through a series of metrics, and we end up with these 6 winners, and they are in the magazine with a full interview and photos. And it's really an excellent way for us to show our appreciation and admiration of some outstanding women. So that's probably one of my favorite aspects of the Lucy Hobbs Project. But I'll tell you, some of the events that we've had, there have been some very poignant moments. And you know, if you would like to be involved, definitely sign up on our website. I'll say it again, lucyhobbsproject.com. That's also where you can make a nomination for an honoree. So thank you. Kay, back to you.
Thank you so much. I was glad you repeated where to sign up for, because I think that's really important to know, because we want more women involved, right?
Absolutely, yes.
So please, if you're listening or if you know someone, please make sure that you reach out to them, because I think it's so important. And it's I actually went to the event. Was it last year? And was it in New York? It was was it last year? Was that one in New York? It was phenomenal.
In Chicago, it was.
So I went to the one in New York. It was just amazing. And it was such a great place to be, with a bunch of women that all were strong, that believed and supported each other. And it was just, so please get involved. I think it's a great thing. So are we ready to get started? Go ahead. You want to say something?
I was just going to say, at some of the events, and one of them specifically has been one of my highlights of the event planning career that I've had. And that is when people started dancing during, like, in the middle of it. They were just, there was an aisle between all of the seats, and people they just started to dance. It was a little intermission before our keynote speaker, and women got up and danced. That really speaks to the energy that, we all have when we get together. So please do sign up.
That's right. It was in Chicago. Now I remember, because we had that glass wall that we went out to. Remember that wall we went out? It was a blast. So yeah, we had so much fun. So you've got to join us. So please make sure you get involved. So are we ready to get started? Yep, I got a heads up, got a thumbs up. Well, thank you all for joining us. So, now we put together a list of questions that might be a little tough to answer. Who knows? It probably will be simple for you guys too. But why don't we start off by allowing each one of you to this is the first one. Introduce yourself. Tell me why you picked dentistry. I'm just curious. I would love to know what made you choose dentistry. So, Dr. Gordon, why don't you go first?
I think the reason I got into dentistry, I was one of the first in my family to go to college, and my parents were very much part of me that just said, you have to do something with yourself. And I mean, this is telling too much about me, but I really love computers. And it was so ancient at the time that I was in that I thought, oh, I'll never have a career in that. So you can be really wrong. And I love sciences. I stayed in that, and I really picked dentistry because I thought it was something that I could have the most balance of life and other desires. I didn't have a lot of support in the college I went, because they thought it was a totally unacademic pursuit, and were not very supportive. But it was fine. It was a very good choice for me, and it was one that I could have the balance that I wanted, and has been a wonderful way to express lots of my own personality and get an awful lot of joy throughout my career. So that's how it started.
Fantastic. And you know what? It's so funny, because even though you didn't go into computers, nowadays computers are all over a practice. So you got both the best world. You got the best of both worlds. You got dentistry and technology. So good for you. So Dr. Hishaw, do you want to go next?
Sure. And again, thank you guys so much for putting this panel together, and of course, the honor of inviting us on. I'm very excited. But my background is that, being brought up in a single parent home, my mom, she just really instilled in me that she wanted me to go into a career that I would really be able to take care of myself and not really need to depend on any man or anyone else. And so I love science. I love I'm a people person. I really care and wanted to serve others. So I was thinking about medicine. And to specialize on that, I was a figure skater. So I had these grandiose dreams of being on the sports medicine team of the Olympic figure skating team and all that stuff. So my undergraduate degree at Pepperdine was in sports medicine, and that really was the track. And I worked as a student athletic trainer, and I hated it. I literally hated everything about it. It took enough for me just to get through the major. It was the athletes. And when we talk about, gender differences, really as a female young student athletic trainer, I didn't quite seemed to gain the respect from the baseball team. And then when I told them they need to ice their shoulders afterwards. So that's a whole nother conversation. But but what a lot of people don't know is that I am a multicultural background. My father is Iranian, and he was a dentist. And he met my mom in the States when he was doing his residency at UMKC, where I got my dental degree. And but unfortunately, during the revolution in the 70s, we had to leave the country. So I didn't really get to grow up with my father. So I didn't get to see him at work as a dentist. And it wasn't until after I graduated from undergrad that I finally got to go back for the first time in Iran since I was born, basically, and saw him at work, and I just fell in love. I just loved everything he was doing, and he was a prosthodontist, so like these masterpieces he was showing me, and he was also a teacher, a professor, and so seeing him at work and interacting with the students, I just really fell in love with dentistry, and so it was a perfect fit.
Well, I'm so glad. That's a great story. I mean, it's nice that when your parents or a dentist, and then you actually followed right in his
Yes,
footsteps.
he was really, really proud. And I know he always said, you have the heart for kids, you love children. And, it was always his dream of mine to go into pediatric dentistry. And I'm happy to say, he was really proud to see that I actually finished before he passed away. But I know I have an angel looking over me and super proud.
It always makes you feel good, though. No matter what age we are, we always want to please our parents, and that's a good thing. That's not a bad thing. That's a really good thing. So, Dr. Bell, why don't you tell me a little bit about why you picked dental school?
Absolutely. Good evening, everyone. And thank you again so much for inviting all of us to be here on this panel tonight. I am honored to be one of the new faces of dentistry and to be here to share my story. So much like Dr. Hishaw, I wanted to go into medicine at first. I loved kids growing up, and I thought I wanted to be a pediatrician. And so I went and I shadowed, and I was bored, super bored. I was like, I don't get to do anything. And so I also grew up and I was missing my lateral, which I soon found out in dental school. That is a common tooth to be missing, but growing up, I just didn't understand why my tooth fell out on the playground and it never came back. So I grew up, I had braces twice, I finally got an implant, and I literally saw my smile transform. And at that moment, I was like, yeah, I have to do this for everyone else. I have to give those smiles back. I have to increase confidence. I want to be that person. And so literally that day, I was like, I'm going to be a dentist. It's no medicine for me. It's not, I don't want to be a pediatrician. I want to be a dentist. And I literally started that day and went to dental school. And just like Dr. Gordon, I didn't really have anyone in my family that's in the medical dental in that field at all. And so kind of I put my best foot forward and found some mentors, and here I am.
Well, I will say this. I love what you said, because what all three of you do that I absolutely love is you all three create beautiful smiles. And this world would be a bad place without beautiful smiles. So I have to hand it to you, because I think that's a good reason to go into dentistry. So let me start off with our first question. So what does it take to be an effective female leader in a historically man-driven industry? So Dr. Bell, why don't you want to start with that one?
I sure will. The biggest thing I think it takes, it's heart. You have to believe in yourself, and you have to know that the place that you are, that one, you want to be here, and one, that you can be here. And so going into school, even though my class was 50-50, a lot of my professors were male. And women came in later, and then also being an African American female, it was different, definitely going through school and having to defend myself in front of professors that didn't think that I needed to be there or deserve to be there. Even now in residency, I have a lot of older attendings that, are looking at me like, is where are you at? And so you have to have heart. You have to be willing to kind of defend yourself in these places, stand up for yourself, speak out for yourself, for classmates, being able to advocate for patients. And then you have to have a strong faith. And I think that's definitely what kept me in school, but just, praying and being consistent in everything that I was doing. And so having that strong faith definitely carried me through everything and got me to the point that I am today. So I think those are two big things, definitely coming into a kind of a male dominated field. But I know Dr. Gordon and Dr. Hishaw, who were in the time when women weren't as likely to be in the dental field, they have a bigger perspective on that. Because like I said, nowadays we're kind of half and half. And I definitely would love to hear their stories on how they were in school and they were, the one or two or three females in their class.
Yeah, that's why I started with you, because I kind of figured I really wanted to know. You're so recent. Like, I really wanted to get your perspective. And it's, the thing that comes across really good is your confidence. You're confident and you know what you want. And I mean, it just gave me goosebumps when you said that, because that's a good thing. I mean, I think that you have to be strong and confident. So who wants to go next? Because either one of you can answer that. You're going to both get a chance. Dr. Gordon, you want to go next?
Sure. So my perspective obviously was a little different. We had the first class of females. There were 10 females at 100 in our class and 500 in the school. So there was nobody to ask or do anything. There were a lot of people that didn't want us there. Some thought it was a novelty. I will say the class itself, the males in the class were enormously helpful and supportive. I mean, it was like having a lot of brothers. But it takes enormous, and throughout your whole career, it takes determination, it takes drive, it takes awareness of who you are. I think the earlier you know yourself and develop that self-confidence and stay within yourself, the better and stronger you end up being. I think for a lot of years, I had to put blinders on and just, not listen to whatever was being thrown at us, because if the things that happened in that era, they'd all be arrested today. So, like it is fine. I mean, we understood, all of us that were in it. And we really had to work, I think, twice as hard to prove ourselves, because you didn't have a choice. You carried the weight of being the female in the class. I mean, you stood out like a sore thumb. So we really just, or I'll just put for myself, and I think all of us, we put our heads down, we worked very hard, and you constantly had to have the determination to get through. But I think that's fine. It helped us through, the other challenges that you will always have.
So I'm just curious, how many were in what was the ratio in yours? Was it 50? Hers was 50-50. How many women were in your class?
There were 10 out of 100, so it's 10%, but that was the highest they'd ever had. So in the school, in other words, that was the freshman class. The other classes had no women. So, there were 10 women and 500 men.
And how many made it through the finish line?
We all did.
Oh, yay!
Okay, they did.
Yeah. Fantastic. That's a good record.
Yeah.
Okay, Dr. Hishaw, you want to tell us a little bit about what your perspective is?
Hi, yes, and yeah, sure. And please just stop me if it seems to get choppy. I may have to plug in with that. But, I was just going to share, when we talk about this, I always think back of, who we are, whose we are is really from really how our upbringing is. And I look to my, what shaped me is just who raised me, really. My mom, I looked at my mother and my grandmother, who are very empowering. And I think we can take that on as just a feminine type of leadership, to embrace the things that make us a woman, that make us successful in dentistry. I know, as being empowered, I embrace my strengths and I go after what I believe. And, even though it was a little bit challenging at times through dental school, and I came out in 2000, I would have celebrated our 20th anniversary, our 20th reunion last year, but we didn't get to, connect due to the pandemic. But, I still was able to achieve things in leadership in the class. I had the support of both the male and female colleagues, but there were situations. And so I had to be just remember who I was, and just know that, as women, we're very generous. We're very generous with our time and our talents, and we pour into others. And I think that helps us to be successful dentists, because we truly are generous with, our team and our patients, and we're really, really serving them and just leaving a legacy. So I knew that by going into the field of dentistry, I can, we're all dentists, but we're truly just role models, and not only to our patients. I always say that because I'm a pediatric dentist, so I do really feel like that's an important role. I'm sure Dr. Gordon would agree that you want to be the example for kids to look up to. So just using those qualities as women will just help to power us through to continue to succeed and reach back and bring up the next generation of leaders.
I think that's fantastic. And so how many did you start with, and how many was in your class? Dr. Hishaw, how many did you?
You
how
know
many
what? I don't have the exact number. We were about 30 to 40% women, and we all came
Good.
through. We had a graduating class of between.
Fantastic. So, okay, let's go to our next question. So how do you guys maintain a healthy work balance, and what advice do you give to others who are juggling a career, a family, and the community of everything that you do? Who wants to go first? Dr. Gordon, you want to go first?
Sure. Look, I think it changes a lot of times throughout your life. And I think I'm looking at it through a lifetime career of it. And I think you always have to learn your boundaries, accept your limitations. And that doesn't mean that limitation is your lifetime. I think everything doesn't have to be done in one day. I think I thought that early on, and all you do is put stress on yourself that you don't need to. It's a marathon. You've got to certainly take responsibilities and know that you're in charge of your schedule and your life. I think it's just learning who you are and what you need to do to juggle everything. And you have to develop your own priorities. It can't be the same every day. And, it depends what you want to balance. And I think that's the beauty of being a woman through it. We're in a country that we can have those options. We do have those options, and you have to execute to what gives you some satisfaction in all the areas that you juggle.
Yeah, and I do think, times have changed. I think males, husbands now are more helpful, but back then women were kind of like staying home, they didn't work, so having to juggle that would have probably been hard. But I loved how you said the main thing that you did was you put things in priority. You prioritized, you made sure that things were checked off. You also planned it out. It wasn't something that you had to accomplish overnight. So I think that right there is really good advice. So who wants to answer next? Dr. Bell, you want to answer next?
Sure. I think I just learned how to work-life balance this year. I would definitely say in dental school, work-life balance is something that's very difficult that I did not do well. I was all work and kind of no play. In dental school, I also got really involved with leadership roles, locally and then nationally. I actually served as the Student National Dental Association's national president. And so I worked a lot, and my balance was not good. But I think, like Dr. Gordon said, the biggest thing is to learn priorities. And so I learned time management eventually. I learned priorities, and I learned to prioritize sleep, because you need sleep to be able to function, and you also need self-care. And so I think the biggest things with work-life balance is making a timeline, managing out things you have to get done. Because like Dr. Gordon said, you don't have to do everything in one day. You might have a huge task list, but what needs to be done first? What test is coming up first? I see a lot of dental students up here. So what test is coming up first? What skills assessment is coming up first? Or what do I need to work on the most? Boards might be 4 months away, but maybe today I should go in and practice Pross. And so I think really using a schedule, setting out time, setting a timeline to see when things are due, when things need to be done, and giving yourself grace is the biggest thing. Because once you overwork yourself and you get to that point where you're stressed or you're burnt out, it's going to take a long time to recover. So I think the biggest thing is prioritizing, making a schedule, and then doing your best to stick to it, but then giving yourself grace when you fall behind or when you get stuck in lab for 3 hours rather than being in there for the hour that you planned. And then just doing your best to continue to plow through. And like Dr. Gordon mentioned last time, that tunnel vision. So having that tunnel vision to plow through when you need to, but then giving yourself grace to balance that time off and doing some self-care, whether that's a TV show, getting your nails done, or just taking some time to go and hang out with your classmates outside of the lab in school.
I think that, that's really good advice. I know that there's a lot of students watching that, I think that you said a couple of things there. Number one, you said get plenty of sleep. Make sure you get plenty of sleep, because I do think that, I know that when my niece was in school, I think that was the best diet she'd ever been on. She lost so much weight because all she did was study, study, study. So take care of yourself and make sure you take time for yourself. So for all those students listening, that's really good advice. So thank you for sharing that, especially because you've just lived it. I mean, you're going through it, right? So Dr. Hishaw, you want to give us your perspective?
Yeah. Oh gosh, Dr. Bell, I wish I was as wise as you were 20 years ago. It would have saved me a whole lot of grief. I'm just now figuring it out. But it is so wonderfully giving yourself grace. That's so important. But the best term I learned really was that there is no balance. I mean, it's just like really in the face is no balance. Stacey Abrams said it great in her book, Minority Leader, about work-life Jenga. You know, the game where you strategically put the blocks up and you're trying to build your tower of your life. And you have to be very careful on which one you pull out or the whole thing falls apart. And it really struck me because she's just realizing that you do have to prioritize things. And sometimes, like you said, some things are more urgent, really time sensitive, but some are very important and, you know, kind of world changing, life changing. And so we have to empower ourselves to realize that, you know, we are in control of what piece we need to take out, what is the most important strategic move, you know, and understand sometimes it's going to be with the work and sometimes it's balancing with family. For example, right now, you know, it's been a tough week. My daughter had just an outpatient procedure Friday, my 16-year-old daughter. And then she started getting sick a couple days later, and then uncontrollably getting sick and vomiting to the point of dehydration. We were at the emergency room overnight just on Monday. And, you know, at that time, of course, my family was more important, but to cancel the next day at work because I'm canceling, you know, a whole day of patients. And you're always, you know, we're so empathetic and we're worried about upsetting the parents and patients, you know, they've set aside the time, but family was important at that time. But, you know, I was with her yesterday, but I really knew as a practice owner and, you know, I want to respect the time of these families that I really need to get to work today. So I had to look around and lean on my village, my friends, and I have someone who's so dear who stayed with her today. You know, and so it's those things we have to balance that. So sometimes we do have to give a little bit in the family life because of work.
I love
But
what
at the
you
same
said though. Yeah, like taking care of your daughter is like, it has to be number one, right?
right.
100%. I think that that's really important. I think that we all need to do that. You know, it's funny, when we worked in an office, we said that 80% of our patients were awesome. And the 20% of our patients that gave us most of the problem was the 80% of our problems came from that 20% of patients. Most of your patients are going to be understanding. They really want you to take care of your family. And that's why they pick you, because you are good leaders and you are caring. That means a lot. So I'm just curious. I would love to know. So I've always been told it's like 32 hours a week is really that's a good normal week. I mean, anything like any more than that, you kind of burn out. Dr. Gordon, what do you think on that? Do you know, is it average per hour per week for being a doctor?
Oh, I don't even know that I could answer. It's because during, you know, it depends what else is in your life and at the time. So, I mean, certainly in the early part of my life when I didn't have children, I mean, I could work forever. Then you have 3 boys, it's kind of hard to do that. You know, and you really have to try and moderate how much time you can give to each thing where you're not, you know, getting too thin for anybody, and also balance of sleep. I think it's really important. And, you know, at the stage of my life that I'm at now, sleep is very important or I don't function. So, you know, I've had to cut back. You know, I used to get very excited. The more patients I could see, it was enjoyment. It was fun. You know, it was a challenge. Now, if I try and do that, I lose the energy to get to the next day. So I don't know if it's so much for me, the amount of hours, but what you do in those hours. And, you know, there, again, different times of your life, you're going to find out what the magic is for you at that time.
Well said. I think that was very well said. I do believe that. I do believe though that, you know, you have to give yourself some time too, because I think you can really drain if you just go. But when you first get out of school, that's probably what you can't wait to do, right, Dr. Bell?
Right, exactly. Here in residency, we work 5 days a week, 8 hours a day. And I'm applying for jobs right now and I'm looking to do the same thing. But again, I don't have any kids, don't have a family yet. And I'm just, eager to serve as many patients as possible. But I do see a lot of my attendings work 4 days a week, and that's what I've heard, 32 hours. So, hopefully I'll get to that soon. But like, dental school, it's a constant go all the time. And then here in residency, we're in there 5 days a week. So I don't really know, but thankfully I haven't burnt out this year. So just hoping to keep that momentum going.
Sure. Dr. Hishaw, how many hours do you work a week clinically?
I know. Well, you see that you said the operative word, clinically.
Clinically, I said clinically, that's right.
There's after you see, from 7 to 4 seeing patients, and then it's doing the charts, and then I gotta rush and then pick up so and so from swim, and then so and so from dance, and then I get home, dinner, and then finish up the chart. So I would say it's more 40 plus hours. And definitely that's something to weigh in into going into private practice. And if I could cut that down, I mean, I know we're always striving to, I always say in pediatric dentistry, it is singing and dancing all day. So yes, it's exhausting.
You get a
It
big,
gives us
big,
life, but it drains us too. So
Yeah.
we cannot do that many hours clinically. So 4 days a week is my practice.
fantastic. So now I want to know this, what makes a good dentist and what does it take to build a successful dental practice? So who wants to go first? Dr. Gordon?
Sure. I think to be a good dentist, you need to be a constant student. I think the minute you stop, then you're rusty and can't give your best. I also think you need to be very honest and self-aware. And if you make mistakes or it doesn't have the outcome that you want, that you own it and make it better. And you just constantly work with I mean, for us, it's the child, the parent, and come up with solutions. And, I know part of our logo is your kids or our kids. And I still, no matter what part of dentistry, I think you have to treat them as long as you like your family as your family. And really support and know what your role is. I mean, you're the educator and you want to help the parents make the correct decisions. And as I said, you've got to be the one to educate the parent, the child, for us. And I think if you have to again, be the student the whole time so you can guide them properly.
Yeah, and I think, clearly setting your expectations on what your expectations are for your patients and your guidelines as they come through your practice really kind of helps things run smooth. But you hit it right on the head. I loved how you said, the very first thing you said was making sure that you continue educating yourself, continue going to programs. I think that is so important. So that was a very good point. Dr. Hishaw, do you want to go next?
Yeah. No, I love what you said, Dr. Gordon, because
Dr. Hishaw, you know what I'm going to do? I'm going to let you, Dr. Hishaw, I'm going to let you, Dr. Hishaw, your computer's cutting out. Your voice is cutting out. So Dr. Hishaw, can you hear me?
Like, we want to treat them as how you would want.
There we go. Dr. Hishaw, your computer is cutting out. So I'm going to let you try to get to a better, you might even take off your
Okay, I'll wait. Is it better now?
It's good now.
Better. You got it. Go ahead. Now, can you start?
Yes, I can hear you. Can you hear me?
No, it got bad again. You might cut off your camera.
Okay, sure. Yeah, I'm not sure where I got cut off. I apologize.
That's okay. No problem. And Alyssa will help you. Alyssa in the background, she will make sure. We definitely want you to come back on.
Okay.
So I'm going to let Dr. Bell go. And then while you're fixing that, we'll come back to you. So Dr. Bell.
Absolutely.
What makes a good dentist?
Just to add to what Dr. Gordon already said, because she covered a lot of it, I think compassion is really important. And your patients feel that because you want them to feel at home when they come to the dentist. It's already a very uncomfortable place. They have to sit back, their mouths open. They don't really know what's going on. And so I think compassion and being, empathetic is very important. And then as much as you learn, I think we also have to be educators because we want our patients to learn things from us so they can better care for themselves. Because as much as we do in the practice, if they get home and they can't take care of it at home, then all of our work we're starting back over a negative cycle. And so I think being an educator is something that's very important too. So educating them about oral hygiene, about things they need to do, about brushing and flossing. As simple as that may be for some of us up here, some of our patients don't understand that. And then just being willing to go the extra mile. I think, being that kind of overachiever on behalf of your patients. And so, like Dr. Gordon said, there's something that didn't go right, apologize, take that step back, see how you can fix it, and let that patient know that, this is where we are today, but I want to get you to this next step. So kind of being overachievers as we were in school to get to the finish line, but being that same overachiever for our patients, whether that is, learning more things in classes or doing things over for them, just making sure that we go the extra mile so their smile and their confidence and their oral health is superior, for sure.
And Dr. Gordon, I'm going to have to say this. I was recently in a practice and they were doing x-rays, and everything's digital now. So even in school now, you learn digital. What is it, a different world or what? Like if you had not gone to continuing ed and you were still doing it the way we did it, we had dip tanks. Did you have dip
tanks?
You don't know, Dr.
Look,
Bell,
I didn't wear gloves.
What's that?
We didn't wear gloves.
No.
I mean, there was no masks, no gloves, only for oral surgery and perio. I mean, it's come a long way. Infection control has come a long way.
Yeah, so that just backs up everything you're saying, because honestly, Dr. Bell, you would probably, if you could just only imagine, no gloves, no mask. It was just, we used cold sterile. Things had changed so much. So I think as we move forward and technology continues to grow, I can't imagine what the dental offices are going to look like in the future. So Dr. Hishaw, are you back on now? Let's see. Alyssa, is she going to come back on, or?
She's going to come back on. She's calling in right now.
Fantastic. So I will tell you this, let's go to the next question and then we'll come back, as I definitely want to know, what she thinks about what makes a good dentist. And there she is. So it's your turn to answer, Dr. Hishaw. What makes a good dentist and what makes a successful dental practice? You're on mute. That's the famous words. You're muted.
I know. Well, I didn't know if I was on the phone. There's that feedback. Are we okay now?
Yeah. So you might be able, can she hang up her phone, Alyssa?
Yeah, that's a good question. Dr. Hishaw, can you do me a favor and please mute your computer and use the phone?
Well, here, I'll talk. How's the feedback now? When I muted the computer, that's when you guys couldn't hear me.
Oh, okay, perfect. Well, then let's keep going the way that we are, because your audio sounds great.
Oh,
thanks, Alyssa. Yeah.
Okay.
So we definitely want it. So what's your question? What makes a difference?
It applies here.
Yeah, hang up your phone.
There's a delay. Okay, you just have to roll with it, right?
Got it.
That's
you
pretty,
got
that's
it.
you gotta roll with the kids. But anyway.
So, okay, we're going to keep going because it's not working.
No, I was just going to say it applies here. You have to hire. Maybe I'll just go off the video and it might help with the stability. Can you hear me okay now?
Yeah, that's a lot better. It takes a lot of power to pull the video. Go ahead.
I'm sorry. Yeah, apologies, everybody. I was just going to say you have to humble yourself. Sometimes our ego can get in the way a lot of times. And it's especially coming out of school and you're feeling like you have to prove yourself a lot of the times. There's the imposter syndrome. How could they, say after I get this treatment plan, well, I'm going to go consult with my mom's group, and then a lot of times I remember being so upset by that, but I was like, okay, let her do her thing. I'm always going to supply the facts and, the pros, the cons, the risks, the benefits, and check that to the side and just know that, what's your intention? What's our purpose? Is really to serve our kids and really give them the experience that you would want your child, your patient to have. And I would just say too, not to get burned out and continue to be successful throughout the years of practice is also just remembering you're more than just a dentist. Yes, you may have many titles, a mom, leader in your church or in organizations or mentor. There's so many things you can do, but there's just keeping that remembering that you have to kind of keep that creativity and doing other things to help you to just feel balanced. And so that's what I would just recommend.
That's fantastic. And you know what? I think you also brought up something really good. I loved how you said, you also, besides what you lived through in dental school, you will also get parents too that may not agree with what you're doing and want to go. And that needs to be okay. You need to be confident enough to say, that's fine. Go get your second opinion, but you really stand behind what you do. And I think that really speaks highly for you, because I think that's a good thing on both sides.
Yeah,
so, all right.
Women, we probably take on a lot of that, and we're just so nurturing and empathetic that we just feel so bad, instead of just saying, okay, that's fine, that's what you need to do, and move on from there.
Absolutely, and keep your head held high.
Yes.
So I want to ask you now, why is mentoring and giving back important, and how do you get involved?
Well, I'll jump at that.
Go ahead. You go right on.
Mentoring is my passion. Mentoring is, as I was mentioning, just serving as role models, and not only for your patients, but just sometimes you can be the first adult outside the home to inspire a child. And when we talk about dentistry and look at the diversity in dentistry and where we're, quite frankly, we're far behind in dentistry and representation. And it first struck me a couple of years ago when I saw the statistic released by the ADA that just 3.8% of dentists were Black, less than 5% were Hispanic. And I just was shocked that we were still experiencing this 20 years after I came out of dental school. And so what I have found in doing the mentoring, that a lot of kids are just not exposed to dentistry because they're not seeing dentists that look like them. And by just reaching out them and at different stages, it can be from childhood, because I feel like getting them on the right track early helps plant that seed and help them work towards something, and let them know that dentistry is not only a wonderful career, but a viable career for you, and you're worthy of being a dentist. This is what you need to do. Because if they don't have that guidance, then they can go off track, not get the right courses or curriculum to help them be successful, attractive candidates as they're applying to dental school. But that's early on. And then we have our pre-dental students. And me as a dentist now, 20 years, I still look to mentors to do new things. If I wanted to get into more speaking or start a nonprofit, I needed a mentor. So it's always important. I really, truly feel that we, as the quote goes, we rise as we lift others up.
I love that. And you know what? It's true. I guess I didn't think about that. There are kids out there that really don't even have that in their vision. Like, I will never be able to do that. And so by you stepping in and getting involved, that kind of like this warms your heart, right? It makes you really feel wonderful. So, Dr. Gordon, what about you?
I think the success of our future really is always laying good foundations and learning how to branch out to lay the foundations for others is the only way we're going to succeed. So, I don't know every place that there is a need, but I certainly try to go into the schools. I have brought in other females. I mean, ones from our class. I mean, any place that you can really be an educator is a time that you're laying foundations. And to me, that's the success of the future of dentistry.
Absolutely. So I'm just curious, have any of your patients actually become dentists yet?
None have. There is one that I have been working with that went into pediatric dentistry. They have been in all kinds of things. I mean, I can't tell you I have one that's coming in, but I have certainly heard an awful lot, because we had, I'm sorry, it's an aside, but one of the pediatricians was always very angry because he would tease me that all my patients want to be pediatric dentists. They don't want to be physicians. And I'm going, well, that's our role. We really need to make it fun and inviting and, a good place and a healthy place for them to be. So,
I had to ask that because I could see that happening. I really, really could see that because you've got this great personality, and I'm sure everybody comes in, they want to be that. So, and what's fun is that you've probably seen a lot of kids grow up and do different things, and it probably makes you feel really good.
It's very exciting. I mean, our office has a lot of children's art. So through the years, because I think it's one way that they express themselves. So we basically built our office that was children's art and like an art museum. And a lot of them have gone into art, have gone into architecture, have gone into different things, and they still have their little drawings throughout the office. So it's been fun to see.
I love that. That's fantastic. So Dr. Bell.
Absolutely. Dr. Hishaw really hit it on the head. And I think I'm from a very, very small town, Elizabeth City, North Carolina. And so there was no dentists and no doctors that looked like me. And so seeing kids now that are, growing up, they don't have exposure. They don't know what it would feel like or what it looks like. They don't have that in their viewpoint, like you said, to kind of dream to be a doctor. It's hard to dream to be something if you can't see that. And so mentoring is something that's really near and dear to my heart, just because, I have prided myself on being a role model from, a very young age for kids in my hometown. But being to the level now where I've learned so much and people have pulled me up, like Dr. Hishaw said, you rise when you pull others up. And so that's just something that I really pride myself on. From once I got into dental school, I took pride in like, oh, you want to go to dental school? Well, come, let's have this conversation here. And so that's things that I like to do. And I have mentees now, and I have two my mentees, two that are in dental school now, and 3 that got accepted this year. So it's just really good to see people reach their goals, and that's something that I love to do. And then actually right before dental school, I actually was a teacher. And so that's where I kind of honed into like, oh my gosh, it's so great to be able to pour into others. At that time I was teaching math. And so just seeing them pass their exams and things. So seeing those students now that I get to talk to and help them through their personal statement and things of that sort. And then them now in dental school and excelling is just something great to watch. So something that I love to do, that I hope to get more involved in, and to continue pouring back into those students, because that's the only way that we can keep dentistry growing and keep our field growing and help to change the status quo of those numbers that have still been stagnant for so long.
I love that. I'm going to tell you, I almost feel like she's going to be a pedo. She's going to be a pedodontist. We're going to get her. Am I right? Are we pulling her in?
Oh, yes, we do.
Everyone says that. I had professors, I had friends, even my friends now that I've met through like SNDA that are pedodontists. Kids, you're going to be a pedodontist.
Yes.
I love kids, but I love everything else too. So
you do all of it just on little teeth.
We're gonna write this down, okay? And we're gonna see what it is in 4 years, all right? Because I have something tells me.
Okay, I was just gonna say, Dr. Bell, she really is, preaching. I see on her social media, she's really giving tips and tricks and for students that are really looking into like, what could they be? What can they do? What is dentistry all about? And I think you're doing such a great job on that front. And I want to recruit you over to diversity and dentistry mentorship.
Absolutely. Let's talk about that, Dr. Hishaw. Absolutely. I would love to be a part.
And Benco is doing such an amazing job just amplifying our voices and the need for diversity. I mean, kudos to Benco. Benco Family Foundation really helped in this virtual mentoring that we did with another national nonprofit, US Dream Academy, and they supplied electric toothbrushes, and we got white lab coats for the kids. And these are kids that just never would have dreamt that they could ever be a doctor. And just to wear that, it's a sight to see. So thank you, Benco.
You know what? I actually saw the pictures. I saw, the pictures on our website. I am very lucky to work for this company. I mean, just like Chuck coming on tonight, he really and truly takes pride in everything that we do. And they are such a caring and giving family. So I am really blessed that I know Lindsay would think the same as me. We are so blessed. So thanks for saying that. And I'm sure that they appreciate that very much. And I do remember seeing all those little kids in the white coats. I just thought it was adorable. So, okay, so let's move on. So as a female dentist, what are some of the biggest challenges you face in your career and how did you overcome them? So who wants to go first on that one? Any volunteers?
I'll go. While my internet's stable, I better go.
You go.
Okay, so boundaries. I just had a birthday this month and I said, I declared it out so everybody would know. I'm like, heads up, I am saying no to stuff. I have been the one to overcommit and overstretch and overdo. And it's just, I think the upbringing and, what was instilled in me from my mom, just as an African-American woman who had a lot of things that weren't open to her, that she just really wanted me to succeed. And you have to do this, you have to do twice as much and all that I tend to overachieve, And so sometimes it comes at a cost of my health. And I did, I had faced with a life-changing, medical issue that I've overcome. But I just think that when we are saying yes to everything, then we are not whole, full enough to do be there for what's most important. So truly the boundaries, and not overcommitting to all the things in your community, and or maybe just saying no to a bridal shower, a baby shower, so that you can spend time with your family. And so you don't have to go to all the networking things if you rather get home. Or sometimes it's just things as far as balancing, and those boundaries not only in time but also in relationships. I think for women, and I'll speak for myself as a business owner, sometimes a challenge for me in the 20 years I've been practicing is with the team. Our team is primarily female, and I think sometimes they kind of pull on the heartstrings of us, of saying, without giving enough time off to say, I need to go to my kids' play, so I'm not going to be able to come in tomorrow. I didn't realize, and they probably feel that we're like, oh, well, okay. Well, here I am struggling with wondering if I should cancel my patients when my daughter has been in the emergency room till 3 a.m. because I know if I'm not working, I have to cancel about 37 patients. The staff is not going to get their hours. We have all these things. But I often wonder, would they ask the same thing of a male counterpart, a male dentist, as they do to female dentists? And so if it is hard for you to say no, or no, I don't want you to wear the fluorescent nail polish to work, then perhaps you need to have it in the handbook. And I literally do, having a kind of lock solid employee handbook, so that if they do come to this, or they don't give you enough notice on asking for vacation, because like, well, but what does it say in the handbook? Or am I going to be able to wear this, that, or the other? It's like, well, I don't know what's the guidelines. Let's just double check the handbook. And that just helps kind of make a little bit of a buffer between there. But boundaries, that's always been my issue. I think it's also for any people pleasers, and a lot of dentists are.
That's I mean, you're preaching to the choir. When we work with practices, that's probably one of the best things I tell you, because the team will come to you and they'll want time off, and you'll say yes out of just the blue. And then all of a sudden someone else comes and you said no. And now you're like, oh no, I've said yes to this person and no to that person. And do you like her better than me? Or like, what's up with that? So having a handbook, an HR manual, and following it, that everybody is treated equally. You just hit it on that to me, you got it 100% right. That is 100%.
No, it's so true. And it's just taken all these years to really, really hone on that, and just stand in the power of knowing that it's okay. Because, you don't want to hear like, oh, well, she's being mean and labeling and all these name calling, versus it is what it is. And and you'll gain that respect. I know, or at times, sometimes we worry about that, oh, they won't like me, but it's like fair but firm.
No, I loved it. I think you answered that 100% right. So Dr. Gordon, what about you?
I'll say one ditto to everything that Dr. Hishaw just said, because I think that goes into the drama of a practice. And, we can evaluate that later if you want to go into it. And I think the only other thing that I really had a difficult time or challenge that you asked about was when I was building the building that I'm in. I thought I couldn't believe that in such a late part of my life that realtors and women trying to build buildings was not something that, I had always gotten along very well as a female, that there were still doors that were much more difficult than others to open. And so I'm talking about two different things, but the boundaries, I think, are important for your own self, for your practice, for everything that you do. You want your whole staff, and I think I've been with mine for so long that it gets very, very difficult because we love them as family. We've worked with them, and for me, 25 and 30 years, but they're not your friends. And it is very hard to set that. You've got to be able to take the practice and what's good for the practice and be consistent. I mean, certainly, you know, compassionate. I mean, we had an episode today, one of our hygienists, you know, she just found out that her mother was put in hospice. Well, I've never seen a group, you know, they've been, you know, it's not been a great week. They've been a little sour. They this, that, and that happens. But that happened, and everyone came together. Everyone makes those kind of things happen. It's just the little nitpicking that goes on earlier on when you're not consistent. That's not healthy.
So I was going to ask
it becomes a dysfunctional family, and you don't
Yes.
want that. Yeah.
No, dysfunction is not good. So I want to say this. You mentioned something earlier in this conversation. You said one of the biggest stress factors for you when you were building a new building was that really stressful?
It was only stressful because I had built the building with my father, or so I thought, and just learning the red tape that goes on in the world today. And I would call realtors and they would never call me back, and how to pursue getting land. You know, it was just new to me. And there is the area that I was in was very different than, you know, it's one thing when you have a building and you're just outfitting it, because I had to do that multiple times. That was a whole lot easier than starting from scratch. And, you know, the political ramifications and those type of things were quite a challenge.
So what advice would you give to a young doctor that was wanting to start a new building? Is there any advice that you would give them right off from your experience?
Tell them to email me. I'll be happy to go in depth. But it really, it depends on the area. You know, there's just more. I never understood the political ramifications. I never understood the amount of work. I heard a lot of, you know, I had talked to one oral surgeon that did it, and he said, oh, it took him 3 years to get through just the planning stage. And he doesn't know what he's doing. Well, it probably took me 4. So I was just like, oh no, you know, you got to know the area that you're in before, you know, it's different states or different arenas are very different.
Different guidelines. I know. Well, I've seen a lot of our doctors go through that. We definitely have what we call a design seminar, and we actually let people come and listen and watch that, because I just sit through a whole day of it, and it is a lot. I mean, there is a huge checklist that you have to accomplish and abide by. So I can see that being a very big stress factor in someone's life, building a brand new practice and having to pick everything up and move, and then also continue to work, right?
Yeah, I mean, we had one practice, you know, that I was working in, and then I was building the building, and they're challenges no matter what you do. They're fun. I'm thrilled that I did it. It was the most exciting thing I did, but you know, it's just their challenges every step of the way.
Absolutely.
And it's just learning to be resilient no matter what you're facing.
So Dr. Bell, what are some of the biggest challenges you faced?
Yes, well, first thing, I just learned so many gems that I'm going to be taking with me as I go into practice in a couple of minutes. So thank you, ladies. So some of the things I face, and I think this is more kind of the dental school perspective, but it's that line of like, you know, women are bossy and they're emotional and they're aggressive when we're discussing things. And it could be something about a skills assessment, or we could be voicing our opinion about something that we didn't like about something, how it was said. And so I think we have to kind of find that distinct balance of speaking up for yourself, but then not being too emotional, not being aggressive and trying to say things because a male counterpart can say the same thing and then not get that reaction. And so I think that's one challenge that you have to do. But you just have to be, definitely proactive in standing up for yourself and making sure that you're okay in that space. And I think the second thing is I really like extractions. And so I'll go in with, and this can be male or female patients, and I'll get looked at because I am a small frame. I'm probably like 5'4" on a good day. And so I'll get this look like this little girl is about to pull a tooth, and they're like, can I get the man? Can I get the bigger man? And I'm like, I can do this. Like I can do this. And so then we'll get in there. We'll finally get them numb after they keep staring at me for about 10 minutes. And then we get the tooth out and they're like, oh, wow. And so that's something that you kind of get, because I guess they're used to kind of surgeons being kind of these, you know, bigger male figures. And I'm a small, petite woman. And so that's kind of things that I run into. The patients for sure, those are fun things to do, because I'm like, come on now, let's just open up so we can get this tooth out so you can get on home. But I think you just kind of learn how to exist in those spaces and kind of learn how to respond over time. Definitely the first time I'm like, I go to the gym, I can definitely pull this tooth. And so now it's just like, I did my bicep curl yesterday, come on, let's go. And so you kind of learn how to adapt to those things over time. And they make you, like Dr. Gordon mentioned earlier, everything that you kind of go through or kind of have to get through kind of builds your character and continues to allow you to progress as a clinician and as a professional and just as a person. So it kind of, helps build character all along.
I love that. And you're 100% right too. And I'm going to tell you another good thing about being a woman dentist that I used to love. I've worked with 2 women dentists, and they would help me answer the phone, and it was no big deal, right? It was like they would come to the front and no one would know that they were the dentist. So it was kind of nice. So you can kind of squeeze into any role you want, it's kind of nice, right?
Yeah, that's because women are so used to having to multitask.
You said it, and you do a very good job at it. So tell me, how do you avoid stress and burnout? So Dr. Hishaw, you want to go first?
How do you avoid stress? Well, self-care. Really honestly being serious about it. I think definitely with burnout, and I got to that point after I was sick and I had to be out for recovery. And again, I can share, I was recovering from breast cancer. And I remember checking in with the office managers, like, how are the patients, because we had to reschedule and I was having other people trying to cover for me. And she's like, well, they're fine. I mean, there was like one parent that was like, well, when is she coming back? Because my son needs to get his tooth pulled before he can get braces. And so with that, I felt stress over it. I was like, oh goodness, I can't even heal from that and be whole. So I got very burned out. I felt like I resented dentistry. I was really upset that no one seemed to care as much as we pour into our team and our patients. And my team was very supportive, but at the same time, it's like, and when are you coming back? So I literally came back with only 3 weeks off after a major surgery. And you could tell I was burned out. You could tell the team was like, Dr. Hishaw's not herself. She just seems short. And so I almost have an intervention of sorts. My partner is like, what can we do? And so I realized I just needed to take time to self-reflect on what was going on. I really say it's important to find a niche, something that really brings joy and sparks your interest and passion. And for me, I really enjoy doing infant frenectomies. I love the instant gratification of being able to see a mom who hasn't been able to nurse painlessly to be able to do so right away. So I started doing more of that. I started doing more speaking. So that really helped. I would also recommend to avoid burnout. It's just like we talked about before with your other hats. Make sure you honor your hobbies. Take time to do that. Separate yourself from work. Don't always bring it home. Just really compartmentalize. I know sometimes it's not always possible. Sometimes you are doing charts at home, but really try to be present. When you're at work, you're at work. When you're home, you're at home.
That was probably one of the best things. I mean, honestly, with the women that I've worked with tell me that they don't bring it home. So, I mean, if you can avoid bringing it home, don't do it. I think that was really good advice. Dr. Gordon?
Look, I think everybody's saying the same things. We go back to boundaries, learning to pace yourself, learning to work with stress and figuring out what stresses you. And when you know you've had it, you've got to come up with outlets that work for you, whether it's exercise, whether it's yoga, whether it's hypnosis. I mean, it doesn't matter what, whether it's being with other family members, whatever your outlet is. I think the earlier you'll learn how to do it. And when you get to those points, you've got to breathe first before you can help somebody else. And you will always throughout life have periods in your life that are much more difficult than others. And, you have to take care of yourself first, because you're not going to be good to anything else around your orbit unless you do.
Absolutely. Dr. Bell?
And those hit the nail on the head. I think the biggest thing again is setting boundaries, prioritizing things, and then self-care. So just finding something that really kind of brings you back to center, whether that's meditation or that's just prayer in church, or especially now with COVID, there's so many stresses. I mean, I don't even, I mean, I feel like going to the store is stressful because I have to have this mask on. I just had double mask on at work. I had a shield on. So there's so many stressors now. So I think, like finding outlets, and then just, whether that's sitting with candles in your bathroom, or you need to take I think also important, take vacations, take days off. I think in dental school, I had to untrain my brain. I thought like days where I didn't do any schoolwork, I thought I was being unproductive, and I would actually wake up the next morning and feel like I got nothing accomplished, when I actually got a lot accomplished because I reset myself for the next week and gave myself that boost of energy that I needed to get through the next week. So I think just knowing and understanding that self-care, sleep, and time for yourself is super important. And you need to incorporate that in your schedule as much as you incorporate your schedule into your schedule.
And when you do that, you will actually feel better, and you will bring home a better person that your family deserves. I used to travel a lot, and so I would run. So my stress release would run. So I blocked off like a mile run. So I would park my car before I got home. I would get out and I would run, and then I would run back to my car, and then I would drive home. Boom, I felt like $1 million. And I mean, people would call me and they go, "What are you doing?" "I'm running. I'll call you later." I mean, I just like blocked it out. But I knew that if I didn't do that, as soon as I got home, everything was going to come after me, right? So that was really good advice from all three of you. Now, we do have some questions. So Lindsay, do you want to come on? I think there's a couple of questions. So do you want to go over some questions with us?
Yeah, certainly. So our first question is coming from Madeline Bryan, and she asks, how easy is it to do charity work as a dentist or hygienist, especially at a local level for the homeless and impoverished in your area who aren't able to pay for the care that they need? Do cities have a program for charity dental work, or does it depend on the practice you work with whether or not you're able to do charity work?
You want to answer that?
I mean, we haven't done adult care, but I've been involved in so many charity works throughout our community. One, we got grants from the Academy of Pediatric Dentistry. We got a dental van here. We've been out to the schools. We had, I'm just trying to think, Give Kids a Smile Day. We've had, there's just so many programs, Mom and PA, and I think they have it in almost every state, a huge undertaking that, we spearheaded to get free care to wherever was needed. It was a 2-day long event that they do, several times a year. So I think, I have done it through a hospital because I volunteer and I teach there. And I think there are plenty of opportunities. It's just finding them or making them.
Fantastic. Thank you.
Okay, so another comment and question from one of our sales reps in the Hudson region. Says, I am in such awe of all the trailblazers on tonight's panel and their generosity of spirit. My question, what is their morning routine for centering and prioritizing? So maybe each of you should answer this one.
So Dr. Bell, you want to go first?
Sure, I'll go first. So moving here to Atlanta, Georgia, being from North Carolina, I have a commute to work now. So kind of when I wake up in the morning, I make sure I say my prayer. But because traffic is unpredictable, my morning routine has kind of switched to being in the car now. And so I have like a kind of a playlist of songs that I play that kind of center me, kind of just get me in my good headspace. And then after my kind of slower songs, my songs that I spend with my time with Jesus. After that, I have a couple of more crunk songs that kind of get me in the mood for work. So I kind of have like a music morning routine. And like I said, I do most of it in the car because Atlanta traffic is very unpredictable. So by the time I roll out of bed in the morning, because I'm usually tired, I'm literally, getting myself together to get in the car. But I do a lot with music, and then I make sure I say my prayer before I go into the day. And I also have a personal affirmation I have myself, which is really short, 3 lines, but I kind of just speak over myself for that day and saying, you are prepared for this. Every patient that you encounter, you will do your best work on, and that, you know, it will be a great day. And then I start the day.
Fantastic. Dr. Hishaw, you want to go next?
I just love Dr. Bell.
No, I love you. I love
Yeah, no, I do. I have an adaptive version of, I don't know if anyone knows the book, The Miracle Morning, and they talk about lifesavers. And so the savers is an acronym for S is like for basically your quiet time, scripture, or silent time. And the A is for affirmations, the V is for looking at your vision board, and the E is for exercise, and R is reading, and then S is scribe, like for journaling. Well, I don't have that much time to do all that stuff. I'm like, at least I can strive for something. But I do definitely do my quiet time with Jesus. I have a scripture I kind of meditate on. There's a great app called Headspace. Probably most of you guys know about Headspace. I love Headspace. So that just gives me like 10 minutes to meditate to, definitely get centered. And mind you, I learned all this stuff just in the last, few years when I had to go through that whole self-reflection, and I called it the reinvention of Laila. And so I do the affirmations, and I'll do exercise. I have a trainer. I have to, otherwise I don't hold my own self accountable. So I meet with him 3 days a week by Zoom. That's one of those things from COVID that stuck. I was like, hey, I like just rolling out of bed and exercising then driving, coming back. And that's about it.
Fantastic. I love the Zoom exercise. I haven't heard of that one. That's really good, because that way you have to get up. You have to get out of bed, right?
And we just do 30 minutes. It's like 25, but a mat and dumbbells and resistant band, and I get a pretty good workout. I mean, I'm not doing crazy boot camp stuff.
I think that's great. So Dr. Gordon, we're going to let you end it with the last question. So why don't you tell us what you do in the morning?
Look, I'm a morning person, so that's fairly easy for me. I mean, it's just later on in the day keeping me going is something else, but there's nothing very exciting other than I do make sure after shower, get up. I mean, I get up very easily, and, and I have to watch a little bit of news. I mean, whether it's good, bad, or indifferent, I have to. And I always have a good breakfast. I mean, that's my big meal. I love it. And I have to be able to breathe. And, my husband and I enjoy it. So before I get to work, so nothing special.
That's okay. That's your quiet time. That's your time to do what you want. I think the morning is the best time because it's so quiet, right? Am I right? Like that's when you can get up when everyone's still sleeping and breathe. And I just think that's fantastic. I want to say thank you to every single one of you for coming on. I had too much fun. Like, I don't know, this didn't even feel like work. It was so much fun. You all did an amazing job, and you shared so much information. And Lindsay, I know you feel the same way, right? Weren't they great?
Yeah, really inspiring. And I'll probably be reaching out to all three of you to participate in the Lucy Hobbs event.
I love how you said that, Lindsay. We need all three of them. We do. Right. So thank you everyone for joining. We really love hosting these webinars. And please, we'll have to have you all back to come see us. I can't say thank you enough. So guys, we will see everyone next time on our next webinar. And thank you so much for joining us this afternoon. Bye-bye.
It was my pleasure. Thank you so much.
Thank you so much.
Thank you.